Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's a pleasure today to be back with Dr. Elias, Interventional Cardiologist. But once again, it's great to have you, and you've been here a couple months, done a lot of heart procedures in our cardiac cath labs. And for a moment or two though, you want to comment on the role of technology in our program?
Yeah, definitely. Well, thank you for having me again. I think the biggest thing in cardiology is that technology, to be honest with you. We can't do anything without that. I think it starts off with the EKG to look at the electrical, the conduction of the heart and just see if there's any abnormality from an electrical standpoint, and or if they're actively having a heart attack per se, we can actually see that on the EKG. To go into the echocardiogram, which is basically an ultrasound of the heart, where we're actually studying details of the heart. In addition to that, we go to the stress testing aspect. So it's kind of divided, and the way we divide it is you actually stress the patient some way. So you either make them go on a treadmill and see how much they do, their exercise capacity. That's the ideal way of determining somebody's functional capacity, because that replicates to what they would probably do outside of that study. There's other ways if somebody, let's say, have joint disease or knee issues, or just unable to ambulate or be on the treadmill, we actually have a form of giving medication to kind of replicate that. So that's the part where we stress the heart. The other part is actually imaging the heart. So we can actually put electrodes on them and actually look at their EKG as they're exercising. The nuclear aspect is we actually put them in a nuclear scan, and we give them a little bit of a radiation dose, and that goes to the heart and the lung, and we can determine basically any area of decreased, what we call perfusion or low blood flow to that area, and that could be seen on the nuclear scan. In addition to that, we talked about the CAT scan, or coronary calcium score, and a coronary CTA, where we're actually looking at the heart arteries using our CAT scan machine or CT scan. The PET scan, I think, just works hand in hand with the nuclear stress scan, or the SPECT scan, where we look at we can look at the function of the heart.
So the PET scanner has a CT,
correct,
PET CT, which is just looking at the structure and all those things. The other is you inject a dye and so forth, and it gets the metabolic side of things.
Correct.
And then you can combine those images with the metabolic and really see a lot of good stuff. Very specific things relative to heart conditions.
Yeah, definitely. I think that the PET scan, it's a SPECT scan on steroid. Basically, we see much more better definition, and just like you mentioned, the CTs there, it actually gives us the anatomic perspective as well.
Great. Well, again, Dr. Elias, thank you for coming today.
Thank you.
Appreciate got down in the depths a little bit here and some of the details, but I think people benefit by hearing what you have to say. And there is a lot of heart disease in our region, and it's important to have great cardiologists, great technology, great staff, and other people that enable it, and other things that we'll talk more about in the future. Thanks again.
Thank you.